Hi, everyone. Super excited that you could make it today. I am going to go through a little presentation and I'll do a quick demo of our employer solution. Um, and if you have any questions, feel free to just jump in and ask. So, just to level set, what is a family caregiver? Family caregiving is the act of providing care for a relative, friend, or other loved one with physical or mental health problems. So, here we're talking about the unpaid family caregiver as opposed to somebody who's paid to provide care. So this is really something that's done out of the goodness of your heart and as a kind of that social contract that we really feel towards our family members and our loved ones. Team CarePal is a team of caregivers. I'm not sure why that photo isn't loading, but it's a picture of my grandma and I, and this is just really near and dear to my heart because um, I was full-time employed, as was many people who caregive. And I went through the last 7 months of her life caring for her while she had cancer. And part of that journey was getting fired, sitting next to her in hospice, just because I reached a level of burnout where I was no longer effective at doing my job. So this is really important to me that we support our family caregivers in the workplace and that we're really providing them care because not only does this help the company, but it can help that individual maintain their livelihood, not miss paid care or sorry, not miss paid work. And it really just helps everyone. So a couple stats that I really wanted to highlight is that caregivers are the largest unpaid workforce in Canada. So they provide 5.7 billion hours of care annually, or $97 billion worth of care to the economy. This is absolutely staggering, and obviously our healthcare systems could not support that if these people were to just stop doing what they're doing. So we need to make sure we're supporting them. Some stats are 1 in 4 Canadians is a family caregiver, 5.2 million Canadians work in caregive, 74% are employed full time. Interestingly enough, women are actually less likely to be employed full time when caregiving, and that's because they do the bulk of the work of caregiving. They, on average, spend a lot more time, so they're unable to work full time. And then some other things that I wanted to highlight that are just unique to different situations. Caregivers of people with cancer are 2.5 times more likely to reduce their paid hours of work. If you're dealing with somebody with mental health or addiction, or that's another 1.5 times more likely to have a lower work-life balance. That was not on the slide. And caregivers of people in homes, which I think is a really unique challenge that people don't think of. If you're not living with the person, you're actually providing more care, which I think people would think would be the opposite because they're not in your house. You think you don't have to do those basic tasks for them anymore, but really that's when the work picks up. That's when you have this overwhelming responsibility to make sure that they're looked after properly, to go in and provide a different type of care, but it's very all consuming. So those people were less likely to report having a good work life balance. Two-thirds of the people who took compassionate care leave were women, which kind of ties back to what I was talking about earlier. And women make $12,000 less as caregivers on average. So something that's really stuck out to us as we dove into this research was that 62% of employers don't actually know how many caregivers are within their organization. Mental health has been a massive push over the last few years. However, they still don't really understand some of these key drivers, and caregiving is one of the biggest ones. We know parents are at higher risk of burnout, of feeling overwhelmed. Caregivers are another aspect. So there's so much that's going towards meditation or understanding your stresses and being able to properly mitigate those things. We're not actually getting to the root. That's a stat that really stuck out to us. This is such an intersectional issue. And I think this is so important. I've already chatted a few times about how gender really plays a role in this, but culture plays a big role. There's a lot of people who live in multi-generational homes. That's maybe less common for people who are born in Canada. And that plays a whole nother aspect in this. So your career stage also makes a big difference. There's going to be much more negative outcomes on your career at the beginning of your career and at the end of your career than kind of in that middle stage. The time spent caring is a big one. People who reach over 20 hours of care a week are at a really high risk of burnout and depression. There's also parents, we call them the sandwich generation, people who are kind of in that 30 to 40 age range. They have young kids, teenage kids that they're providing a lot of care to. And then they're also taking care of their aging parents. And then age. So uh, when you're young, you often have less money. So that adds a whole level of complexity. But then there's also, as you're reaching your own, you're starting to think about your own aging needs. You're also taking care of parents who might have cancer or be in their 90s. So there's just so many different aspects to how caregiving can impact. I kind of went through a lot of these already, but I think they're just some great stats. So when we look at the different stages, as I mentioned, early career, they often have a lot more limited resources. They feel a lot more isolated in both caregiving and work roles. And that's because there's less young career professionals that are providing care. This is typically something that you see a little bit more in mid-career or kind of that 40 to 50 age range because they're the ones that have typically the parents that are having aging needs. So it can feel really isolating early career and it can stop you from being able to move up in your career. Mid-career, that's when you're really putting in the bulk of the time and effort to move your career up. And there's a lot of different things that impact you there. You're often parenting yourself, you have increased expenses. That's when you're really trying to build your future. So there's a whole bunch of different aspects that are at play there as well. And then late career, you're trying to prepare yourself for retirement. It's really easy to discount somebody who might be late 50s, early 60s, and they're missing work because they're taking care of their aging parents. It's easy to discount those people and say, oh, they're retiring soon anyways, but that's at a point where it's really important for them to have a lot of support so that they can get in shape for retirement. I think these kind of go without saying, but obviously if you have a lot of caregivers in your workforce, you're going to see reduced productivity. And that's because caregivers missed 15 million hours of work in 2018, and that's about 10 hours on average for women and that's 10 consecutive days for women, and I think about 7 consecutive days for men. So that's a huge reduction in productivity, increased absenteeism, and then lower employee retention rate. And that's because 1 in 20 caregivers are just full on leaving the workforce when they no longer handle their caregiving responsibilities with their employment. So we did an economic analysis and we have this wonderful, rich health economic model. So we use this on, as an example, with a company with 500 employees. So in that case, statistically about 1 in 4 are family caregivers. So in a year, you would have retained 11 employees, gained 39,000 work hours, and gained $624,000 in wages and productivity. This is just by reducing the caregiver burnout by about 20%. And that's really cool about this is we can actually do custom analysis for any company. So depending on their gender breakdown, their actual median wage, their actual median age, and different factors like that, we can customize these models. So if anyone is interested or knows a company that would be interested, we'd be happy to put this together to show them the impacts of supporting caregivers. So our solution, that's a big problem. Now we get into what we're doing to help. So we have a free caregiver app. So this combines 7 different tech tools. We surveyed over 50 caregivers and we put all the needs that they had in one app. When we looked at our competitors, they maybe had 1 or 2 features. They had a social feed. Some of them had, the ability to do task lists or events, but nobody was really doing a comprehensive app. And something that's really exciting is for National Caregivers Month, we are launching our new AI-powered chatbot that takes all of the demographic information that's captured in the app. So your age, your gender, your relationship to the patient's condition, your location, and actually the burnout levels that are reported in the app. And it takes all of that and it helps to match up to our database of over 3,000 resources across Canada and give really customized real-time advice. So we're super excited to be launching that. So that's on the individual side, but how are we supporting employers? So we've created an employer dashboard that allows companies to track the usage of the app, which will then roll into an economic health model where we can actually say the impact that's been had based on the number of people that have been using the app. It allows them to actually interact with the app. So they can send in their own resources, they can send surveys to employees, and they can really interact with it. And we have a separate product that gives you another level of interaction. If it's something that's of interest, this employer dashboard is kind of stripped down because we understand that most employers need to keep that level of confidentiality and not be too involved in the solution. However, we do have a whole other CRM solution that allows them to be super involved by creating posts and creating task lists. And it goes really deep. And that one's typically geared towards health organizations. I'm going to switch right now and I'm going to actually show you our solution. So this dashboard provides a lot of rich data. So it shows the number of communities. So if you've given this to a company of 500, you can see who's actually utilizing it. You can see the average number of caregivers per community. So this shows how many people they've invited to be part of their support network. So it gives that metric of the support that people have. I will show the app in a second, but this also shows the average burnout level, which is really interesting. So you can track kind of the trends of how that's working. It shows the number of active users in the last month, the communities by condition, so that we can actually provide more customized solution. If we're seeing a lot of people with aging needs or cancer, we can provide customized solutions to the employer. It also shows the user ages, which is just an interesting stat for for employers to be able to understand who's actually using this, user locations, and then user relationships. And I think that's really important too. Not necessarily everybody that uses this solution is going to be the primary caregiver. In an employee situation or an employer situation, it's not always going to be just the child. It could be the grandchild that's disproportionately impacted, the sibling, even just a friend. So by giving this solution to your employees, you're able to actually support the broader range of caregivers. And not everybody will actually identify as a caregiver if they're just somebody that's helping out a little bit, or they're maybe the grandchild or the niece. But it's important to help them to understand that they are caregivers, that they can offer this solution to their families, and they can really create a bigger impact. Even if they're just reducing their burden by 20%, it's still impactful. I want to jump over and show the user app. So I will just switch my screen. I have so many screens open. All right. So this is our and so this is what would actually go to the end user. So this allows you to create a community around yourself. So the primary caregiver gets access to the app, or whoever within your organization is part of that community. They would get access, and then they can invite everybody else. So they can invite anybody across the whole entire world. There's a lot of people that caregive. I just talked to a caregiver yesterday who's the majority of their family is in Ontario and Florida, and they're here with the loved one. And so this allows them to add all of those people, provide updates. My dog is the use case. He's a very chunky little puppy there. So the news feed is a great way to update a lot of people at once, but keep it off of Facebook. It reduces that burden of people constantly texting you asking for updates. It allows you to keep important things like announcements up at the top here, so that what's really important is highlighted. It allows you to create task lists. So I've created a little task list here for my dog. We're caring for him, and it allows you to just delegate in a way that doesn't actually feel burdensome to the rest of the people in the community. So here I've created 3 tasks. Anybody can log in and they can just take these tasks. They'll now show up on their tasks and they'll get reminded to do them. So it's a great way to just put it out there what you need help with and get help without asking. We've created a calendar. I know when I was caregiving, a big burden was constantly asking my uncle, who is the primary caregiver, when is her chemo appointment? When is her next doctor's checkup? When is the nurse coming in? This allows you to put everything in one place. People can RSVP. You can also create private appointments. that are just accessible to caregivers, which is people that you would designate as that kind of second tier, that they're able to see a little bit more information in the app if you don't want everything to be public. Under resources, it's really exciting here. So we are slowly building this out, but as different organizations subscribe and use our software, they're listed here so you can actually interact. And our goal is to have over 100 different supports in the next year that will be listed here. But starting May, under My Resources, you'll also be able to access the AI chatbot. My absolute favorite feature that I will show you next is the journal. So this is a journal. We kind of model it after Google Docs. It's really flexible, and it allows you to do any sort of section you'd like. So you can create a section that would be called medication reactions. You can call it doctor's notes. You can call it doctor's appointments. You can create any section you'd like, and then anybody that's designated as a caregiver can go and put entries. The really exciting thing about entries is you can upload images and videos, and it also has a voice recorder. So you can record any of the doctor's visits. This is something that we often did when my grandma was sick, but it was difficult to keep those things organized. I would text them. It was hard to find them in our text conversations. This keeps it all in one place. You can also put in any prescriptions or anything like that through our upload image. And then assessments. So we use the Caregiver Burden Inventory Assessment, which is the industry standard for assessing burnout in caregivers. And you take this assessment once a week. So it allows you to track your burnout levels, and it also asks you the number of hours that you're providing care. And this will allow you to kind of understand between the number of hours that you're caring and your burnout levels, what that looks like and how it's trending. And coming in May, our AI chatbot will be able to give you real-time suggestions to mitigate this burnout. So this is the app. This is the core of our solution. And this is what you're able to offer your employees when you sign up as an employer. A couple other things that I think are important to highlight. If you're an employer that's trying to support caregivers in the workplace, a lot of employers offer flexible work arrangements, and they really feel like that is a good solution to helping their employees that are caregiving. But it's important to note that in the studies, 1 in 2 caregivers felt that flexible work arrangements would actually have a negative impact on their careers. I think this is really interesting to highlight because it's one thing to put out these practices, but it's another thing to truly mean it as an organization and create that culture that people don't feel like they'll get in trouble for taking advantage of those different perks and that flexible work schedule. Caregiving is often done, caregiving allowances are often done one-on-one by manager or HR. They said, sure, you can take off this Friday to take your loved one to chemo, or, sure, you can start coming in a little bit later so that you can do her morning care ritual in the morning. And that's done one-on-one. But by bringing in a solution like CarePal to your organization, it creates that culture that we do value caregivers, and we actually allow you to take those benefits instead of it kind of being that one-off, that dirty little secret that we don't want everybody to know about. We offer a couple other exciting things for employers in our employer support package. So not only is it premium access for all employees, you get monthly app support webinars. So just once a month, we'll pop on any employee that's having difficulty using the app. So, just depending on their where they're at in technical abilities, they might have difficulty getting onboarded or understanding how to use the app. So they can pop into our Zoom chat once a month, and we'll just walk them through any questions they have. Quarterly usage report and their economic impact analysis. Really exciting is access to an employee caregiver navigator bank of hours. So a caregiver navigator is somebody who often has been a caregiver themselves. They understand the landscape. They understand what that journey with that specific disease looks like. And this bank of hours allows your employees to say, my dad has cancer. I'm scared about this journey. And we'll be able to connect them to somebody in our network, and they'll be able to guide them through that. So it's that little bit more hands-on. We also do policy review and coaching for your senior leadership to help them bring more caregiving practices into the formalized policy, yearly management training, mostly on empathy and understanding the needs of caregivers. Also, yearly assessment of employee needs. We can do some of that through the dashboard, but also some through anonymous surveys, just understanding do we have a high proportion of people with cancer for their loved ones? Is it aging needs? And then how can we provide content and webinars and support to meet those needs? And then the Team CarePal certification web assets. So once you come on as an employee, you're actually able to use that branding in your recruiting and put your stake in the ground saying that this is something you value. That's kind of all I had today. We are a team of caregivers. We are super passionate about this. Our founder, Cindy, and CEO, she actually cared for all of her grandparents and aging relatives. So she came to Fog App Developers where I was working at the time, and she came with this idea. And I have to say, like, I always thought it was amazing from the very beginning, but I didn't quite get it until I went through it myself. And a couple weeks after my grandma passed away, I reached out to Cindy and I was like, I want to be a part of this. I'm super excited. And over the last 2.5 years, we've had the pleasure of talking with hundreds of caregivers and really understanding the burden they face and the burnout levels they face. And it just feels really good that we're at this place and we're getting really great feedback from the community. And we have these products that can now support caregivers in lots of different aspects of their life. So that's all for me. Anyone has any questions, I'm happy to open it up.
Just gonna say this is awesome, Paisley, because I think more conversations need to be had around this, and to be able to have a tangible tool to actually give employers, and that analysis piece, I think, is another thing that really stood out to me. So thank you for this presentation.
Thanks, Angela. Thank you, Cynthia.
How many organizations have adopted this so far?
This is actually our launch today. So
congratulations.
We've been in conversations with quite a few since January when the tool was completed, but we've just slowly been introducing it. So we are in conversations with quite a few. Our health system, which is a little bit more of a built out system, that I said allows you to kind of go one level deeper. That is actually being used in some care homes in Saskatchewan. It's being used by caregiver navigators, but this employer solution is brand new.
That's great.
Great. Well, thank you, everybody. I didn't take the full time, but I just wanted to showcase our solution, and this has been recorded. So if it's of interest to anybody in your network, I'd be happy to share it, and you can pass it along.
Paisley, I just wanted to echo the comments already that the platform and its comprehensive nature are most impressive. One thing that I wanted to better understand was the co-development partnership relationship with insurance companies and how that works for you.
Yeah, so we're just currently talking to several insurance companies about getting this on their benefits plans. So right now it's not, but hopefully it'll be part of employee resource management systems in the next couple months is what we're looking at.
Awesome. And what kind of feedback are you receiving from them and their interest?
Yeah, this is something that's not really talked about right now. And so we're getting huge interest, but right now it's been helping them to understand the exact issue and the breadth of the issue, because most of their solutions currently are a little bit more generic in terms of mental health and they don't get into the specific causes. So there's a lot of interest, especially when they see the staggering numbers of caregivers in Canada. But I think it's not something that everybody really realizes is such a big issue. Maybe they've been through it themselves or they've seen people go through it, but they don't have that understanding that it's literally 1 in 4 Canadians.
You kind of need visionaries, right? Like who can see ahead, because this is going to have like quantum leaps, this impact of, people becoming caregivers more and more and the impact on them. We're hitting the age now, right? So
yeah, as our population ages, and I'm not sure about how Quebec is, but in Alberta, our healthcare system is struggling immensely. It is really, really bad.
Canada.
Yeah, it's across Canada. And we're actually doing a pilot right now in Saskatchewan with transition beds. So people are, in acute care in the hospitals, and hospitals are getting dinged on readmission rates because they're not properly transitioning people out. So CarePal is actually part of a pilot right now that better equips caregivers to make that transition better into the transition beds and then hopefully get them back home as opposed to get them back into long-term care. And it's just trying to make that process better, bring in the caregivers so everybody's properly supported. That not only helps the hospitals that aren't getting dinged on readmission rates, but it's just so much better for the patient because people want to age at home. And this is such a great tool to help them actually be able to do that because 1 in 9 long-term care beds in Canada are actually filled because the caregiver just couldn't do it anymore.
Absolutely. Absolutely. And tell me, your app is only in English for now?
It's only in English. It should be in French in the next year.
And your
It's
supporters, you want to extend your supporters. So you want to extend to have like 100 organizations kind of in the support network. Is that across Canada? Is that only in Saskatchewan? Like, who are you targeting?
Yeah, it's across Canada. So anybody that signs up for our caregiver CRM, which is what somebody who like a long-term care or home care provider or practitioner, they're the ones that would then be listed. They can choose to be listed or not. So we do have some people using it that they're private. It doesn't make sense for them to be listed. But we have a speech pathologist using this. We have a dementia solutions. We have a few caregiver navigators that are using this. And so they'll be listed in the app. And so like a long-term care could also be listed in the app because it allows people to subscribe to them and then they can push their content, their resources, their events and different things like that. So another pilot that we have going on is actually with a home care company in Edmonton, and this will help their members that are part of their day programs get more engaged and support them because right now a lot of the bulk of the resources are going obviously towards the people in their homes, but they have all these day programs that are completely oversubscribed because people need the support so badly. So we're doing a pilot giving Team CarePal to everybody that's part of the day programs so that they can push the content to them, push more of their programs and give them that next level of support. So they'll be available to subscribe to in the app as well. Kind of a social media.
That's great.
Thank you so much, everyone, for coming. I really appreciate it.